Hello, everyone. I am Angie Stier, and I will be talking to you about the cytomegalovirus, which is also called CMV. CMV for short. So, CMV, 1 in 3 children will be infected with CMV by the age of 5. These children often show little to no symptoms, but can transmit the virus to others via urine, feces, tears, or saliva. Over half of adults will get CMV by the age of 40. Often medical treatment is not required or necessary for healthy individuals. Once infected, though, the virus will stay with you for your entire life and can reemerge later since it is a form of the herpes virus. CMV is the most common cause of birth defects in the United States. Infections during pregnancies. Typically, a pregnant woman doesn't even know they've gotten infected with CMV. There's little change in symptoms for pregnant mothers, and there are blood tests that can detect the presence of CMV. But infections during pregnancy can cause serious birth defects for an unborn fetus. When babies are born with CMV, it's called congenital CMV. When CMV infects a pregnant mother, 40% of the time the unborn fetus also becomes infected through the placenta. Tests to detect CMV in newborns are performed with urine or saliva. The effects of CMV differ based on the fetus's gestational age as to when the virus was contracted by the mother. Based on age of contraction of the virus, babies can have serious or mild complications. Complications of congenital CMV. Congenital CMV infection has a negative impact on development that is correlated with neurologic and vestibular impairment. 1 in 200 babies are born with congenital CMV. Of those 200, only 10% show signs at birth. 1 in 5 will have long-term health problems. Infection early in pregnancy in severe cases can cause death to an unborn baby. Some babies have problems at birth, and some develop problems later in life. Signs and symptoms. The potential signs at birth include hearing loss, a skin rash, jaundice, which is yellowing of the skin or whites of the eyes, microcephaly, which is a small head, low birth weight, hepatosplenomegaly, which is an enlarged liver and spleen, seizures, and retinitis, which is damage to the eye retina. Potential long-term effects, things that come across later. Some of them carry over from signs of birth, but they can also be found later in life. These are sensorineural hearing loss, intracranial calcifications, vision loss, microcephaly, which is the small head again, seizures, developmental disorders and delays, and intellectual disabilities. Hearing loss. CMV causes lesions in the cochlea and vestibular parts of the inner ear, leading to sensorineural hearing loss. Hearing loss can be present at birth or may develop with age. This can either be progressively changing, it can change as the child grows, or it can also be suddenly. Suddenly, a 5-year-old child can lose their hearing, or it can go from mild to no hearing, profound loss. CMV typically does affect both ears, which is bilateral hearing loss, but may also have the baby may also have hearing loss in just one ear, which is unilateral, and that same baby could also potentially develop hearing loss in that other ear over time. CMV hearing loss can progress, ranging from mild to severe into adolescence. A skin rash. A pectoral skin rash is due to bleeding underneath the skin. This rash is typically called blueberry muffin rash and is usually present at birth. It's characterized by wide, non-blanchable macropapillar lesions of red, blue, or magenta in color, meaning non-blanchable. You touch them and they don't go away. In most cases, the illness regresses without complications within 4 to 8 weeks of birth. And that picture to the left is an image of what that skin rash looks like at birth. Jaundice is a yellow discoloration of a newborn baby's skin and eyes. Baby's blood contains an excessive amount of bilirubin, which is a yellow pigment of the red blood cells. It's a common condition, particularly in babies before 38 weeks. This also includes healthy babies. It usually occurs because the baby's liver isn't mature enough to get rid of bilirubin in the bloodstream. The common treatment being used is light therapy or phototherapy, which is a blue light that they put the baby under for 24 hours or more, depending on the severity of the jaundice. The light changes the shape and structure of bilirubin molecules in such a way that they can be excreted through urine and stool samples. The picture to the left shows what that yellowing, it's a pretty extreme picture, but it shows what that yellowing looks like in comparison to healthy skin. Microcephaly, which is the small head. Again, the picture to the left shows a baby with a small head, and the dashed line is a normal size head in comparison to the microcephaly head. So the baby's head is significantly smaller than expected. Symptoms vary and include intellectual disability and speech delay. In severe cases, they may be having seizures or abnormal muscle functionality. There is no cure for microcephaly, but treatment involves just supportive care, symptom treatment, symptom management, and close monitoring. Low birth weight. When a baby is born weighing less than 5 pounds, 8 ounces, it's considered low birth weight. The premature births, which are before 37 weeks of pregnancy, and fetal growth restriction are the most common causes of low birth weight. A baby with low birth weight may have trouble eating, gaining weight, and fighting off infections. The image on the right shows you what a normal or an average size baby would weigh based on their gestational age or week of development. Hepatosplenomegaly. So this is when both the liver and the spleen swell beyond their normal size. The liver is unable to process glucocerebrosidase, which can lead to severe damage to the central nervous system. The image again on the right is a baby with an enlarged liver and spleen in correspondence to the baby's body, which is quite dynamic. Seizures. This can also be present at birth, and seizures can also be found later in life. Kids can develop them later. They are involuntary spasms made by muscles in the arms and legs that become stiff and bend the baby's head forward. They result from brain calcifications and other abnormalities in the brain and central nervous system. An EEG test is used to study local or potential seizure activity. MRI and CT scans are used to analyze brain areas where seizure signals occur. Babies might have slow development or loss of skills, like babbling, sitting, or crawling. They might do those things a little bit later. Seizure medications are effective at minimizing these spasms. Retinitis. Retinitis is an inflammation of the retina within the eye and can lead to blindness. Early detection by an ophthalmologist is key. Essentially, what they do is they take a tiny little baby, they open up their eyes, put a light in there, and look into the retina, and you'll see in the image on the right what CMV retinitis will look like in comparison to a normal retina. And what usually happens is it starts out in one eye as blurriness, blind spots, or specks in the vision. There is potential for retinal detachment. Cytoflora is approved for the treatment of CMV retinitis, but glancocephaly can be given intravenously, orally, or as a pellet implanted in the eye to treat retinal infection. Intracranial calcifications. Now, this is the scary stuff about CMV. The calcifications cause brain damage, and it occurs in 0.2 to 2.4% of live births. This is asymptomatic at birth, and it's detectable around 6 months of age. Around that 6 months age, they'll have a CMV child get those MRI and CT scans to look for these calcifications when brain is just a little bit more developed. Calcifications are white areas within the brain associated with deep white matter damage. The image to the right, you can see a CT scan of a CMV brain, and the outer rim that's white is the skull. The inner areas that are white within the brain itself are those calcifications, and that's a pretty severe case. And again, like I said, MRI and CT scans are used to detect these calcifications. The symptoms that I previously mentioned are not limited to these alone. There can be many strange little things that pop up with CMV children, but however, the symptoms and effects described are the most common for congenital CMV disorders. The effects of congenital CMV can be lengthy and they change with the developing child. Rarely do CMV children have the same effects due to the virus. So treatment. Valcyclovir is a common medication used in CMV antiviral treatment. This medication is also used to suppress the herpes virus. Antivirals are commonly prescribed for CMV babies to suppress the virus until the baby's immune system can fight it off on its own. Antivirals are recommended through the first 6 months of life, and medication is only effective if CMV is detected within the first month of life. That's the pretty serious part. Rarely will hearing loss be restored, and CMV treatments do not stop the progression of seizures. And as a side note, CMV treatments is a relatively new thing, and I don't think they've even started prescribing medication like they know what to do with it until like the past 10 years. So this is my daughter, and this is my story. Our 1-year-old son brought home CMV from daycare with no symptoms. My husband and I were unknowingly affected with CMV when I was pregnant between 25 and 27 weeks, and we were told we had the flu. I was induced into labor at 37 weeks due to growth restriction of the baby, and she tested positive for CMV at birth. She failed her hospital hearing test, had a small head and jaundice in addition to being growth restricted. Audiologists verified that she had normal hearing in her left ear and profound sensorineural hearing loss in her right ear. She began antivirals at 6 days old and has had no other complications. In the summer of 2021, next summer, she will be having surgery to install a cochlear implant in her right ear. Before the birth of Aurora, I had never heard of the CMV virus at all, so it was quite a learning experience. But she is 10 months old and she is doing fantastic. So any questions, concerns, comments, please let me know, and I look forward to hearing your feedback. Thank you all. Have a great day.